We talked a little bit earlier about how you're completing this medical documentation, whether it's on pen and paper, electronic medical record, electronic health record, some of the different types. And back in 2009, I'm not sure if you were aware of this or not, but the American Recovery and Reinvestment Act mandated that as of January 1st, 2014, that all public and private healthcare providers must have an electronic health medical record in order to maintain Medicaid and Medicare reimbursement levels. And that was 4 years ago. And the fact that many of you may not know about it makes perfect sense because most of the time, athletic trainers do not bill for Medicaid or Medicare and oftentimes are not able to. And so as we think about this was 4 years ago that we were requiring, in order to get government funding and reimbursement, that you had to have electronic records. So why are we not doing this within athletic training? And we know those answers simple, like I said, because we don't have to bill, especially for those services, and oftentimes don't bill for services. But I think it kind of puts us in a different boat with a different question. So athletic training is always so worried about keeping up with physical therapy, occupational therapy, or other allied health professions like that. So why are we not utilizing electronic medical records? We're going to talk about those a little bit here, and there's some different types. So I want to talk about the difference between an electronic medical record and an electronic health record. Within an electronic medical record, there are a large amount of different types, and if I started to name them, I'm sure I would still miss some of the electronic medical records that you have at your clinical site. These are records that you either are given or purchase for a fee, and you're able to put the patients into it, log their care, and can let a certain number of people in with the correct passwords to be able to have accounts and see into that electronic medical record. This is something that stays at your institution or your healthcare clinic or whatever you're working at. This is something that stays directly there. So it is not transferable from place to place. So if we have a high school student athlete who goes from the high school setting into the collegiate setting, that electronic medical record is stuck at their secondary school. But this is electronic record keeping. It is, there's a large amount of different types. Some are really easy to use and some are a little bit harder. And it depends on what you're interested in. There are some options that are available for free. And so if this is something that you're interested in, trying to find what fits you is very important. We also know that there's this electronic health record, and this is that overarching medical record that I talked about earlier that follows you. So a lot of systems, Minnesota has been leading the way with this electronic health record. They are linked, so all your information is able to be in this system and can be linked to the different healthcare providers you've seen. And this is really important to think about for today's technology. So we have so much technology and so much has been adapting, and being able to have electronic health record or medical records where you're able to easily pull up a week of patient-rated outcomes and see the difference, or able to import the notes and easily see that Jane Doe had sprained that same ankle 3 years ago is really nice and convenient to have within one specific place. You also don't have to worry about the issues of documentation getting lost or seen or taken that you would with pen and paper. So some ways to do this. Here's an example of a mobile documentation unit, and it's a really convenient way to be able to keep the patient's computer. This can actually be something that you can look right in and are able to type directly into it and have that mobile card available. We also can know that within the, we talked a little bit earlier about the office, and so this should be something that medical records are done in private, are done immediately following, and done in a way that people are not able to see them. The next thing is that pen and paper documentation, and so this is what a lot of people still are using, and I think it's something that, although you may not think that you have another option, please try and seek out electronic medical records that are inexpensive or free, depending on what setting you're working in. And it's really hard to compare improvements, patient-rated outcomes, and it's very hard to access. So if we think about, if you have a patient perform 5 different outcome measures, you're going to have to manually look at all of them and pull them out of their record and see it. We also have some legality issues of, being able to see that documentation just sitting there and knowing that somebody could get into it, keeping it double locked, keeping the storage place, and properly disposing of it. We also know that continuity of care is hard. So if you have 10 different patients throughout the day that you want to take care of, then you're going to have to go back through and look at the different charts if you are not the person giving the care from the day before. So sign-in sheets are something I really want to talk about, and I understand and appreciate why people use them. They're convenient. You have a record of who comes into your clinic. But we need to make sure that we keep in mind of the information put on these. So when you go to the doctor and you sign your name and who you're seeing, that's one thing. But if you're asking a patient to put the body part that's injured, the time that they came in, the injury, whether they're coming in for treatment, evaluation, or whatever, we're getting into a very sticky situation legally because somebody is able to walk by. Let's think about it this way. Let's say that you're a secondary school athletic trainer and you have these sign-in sheets and a recruiting coach comes by and they see this list and they're able to know that somebody they are talking about has been seeing you. Maybe it's only for prevention, but we don't know that and they may not know that. We also have these issues with giant whiteboards in offices. So please keep in mind, do not put private medical information up there or have Johnny's whole rehab out on a whiteboard because that's something that everyone can see. Knowing that people came to you, that's one thing, but knowing what they came for you and why, that's another. Because we're worried about that HIPAA FERPA violation. So having too much information on the sign-in sheets is an issue. And this is why I recommend the mobile documentation units that can just go around with you. You can type in, or depending on the luxuries you're able to have, some electronic medical records allows patients or student athletes to sign in, swipe an ID card, or many different ways of letting them know who was in your clinic today. And so although these are a great idea and very easy to do, that HIPAA FERPA violation is just too important to be able to keep going and not allow these sheets to happen. And overall, like I said, this is for communication. We document to be able to keep that continuity of care between the patient, maybe their parents or other caregivers, other healthcare providers, coaches, whoever's involved. This is all very important to have this information together and be able to take care of our patient in the best possible way as a team.